Follow-up question. There are multiple credible reports of what I'll call obscene living conditions in the ACI, in the Cranston facility. A current prisoner, amongst many, cites the absence of mental health, prescription medicine. That shortage is blamed by the ACI on the pandemic. There's commingling of infected and COVID-free inmates. And I'll quote, an environment that has filth, mice and roaches roam the prison, scavenging for any type of food, human bodily fluids left on the walls of the cells, leaking toilets, fluid stripping, mold in the walls. Additionally, just 2 months ago, there was an inmate who passed for still unknown circumstances, and Mr. Jose Franco passed on February 9th. Inmates' family has still yet to be notified of the cause of death. My question is, how often does the Department of Health and their representatives inspect the ACI? What, if any, oversight does the Department of Health have over the Department of Corrections with regard to the basic safety of inmates and their constitutional guarantees not to be subject to cruel and unusual punishment?
That is a question that is separate from COVID, is definitely a story that is of concern and one that we will continue to evaluate, or will certainly look into and evaluate, knowing that corrections also would want to make sure that the right setting is in place for their inmates.
To do with COVID. I mean, if they're being not given their medicine because, and the ACI, which is a state function, is claiming it's because of the
pandemic. We get on to
pandemic.
other questions that other people want to ask. You dominated in the early stages.
Okay, don't answer.
Make sure everybody gets a chance.